And Dayron, I think it's you're going to be driving the slides, right?
Yes, that's the plan.
Yep. Okay.
Yeah.
Okay.
It's 5:03. Yep. You want to go ahead?
Yeah, you want to start? Okay. Okay. So welcome everybody. This is maybe the 6th time we've done an information session for the Population Health and Place PhD program. And this is one of very few PhD programs at USC that aspire to be multidisciplinary. And so the various courses that contribute the heart of this degree can be found in the Department of Preventive Medicine and the Keck School of Medicine of USC, or in the Department of Sociology and Dornsife College, or the Spatial Sciences Institute. So I'm John Wilson. I'm a professor and the founding director of the Spatial Sciences Institute, and it's the Spatial Sciences Institute that's the administrative home of this particular degree program. Next, Aaron. So these are the 3 presenters, and we chose these 3 people because in one or another we represent all three kind of legs of this 3-legged stool here, and we have deep knowledge of probably just one or maybe 2 of the 3 domains that we're speaking of. So both of my colleagues are very distinguished. Professor Smith-Greenaway is Associate Professor of Sociology and Spatial Sciences. Her work focuses on demography, infant child mortality. She does a lot of work in Africa, and she's also interested in health services. She's one of my heroes. I want to be more like her. And another person I want to be more like is Professor McConnell, who's a professor in preventive medicine, very long and distinguished career. He works in a lot of different environmental health arenas, and epidemiology and environmental exposures and community-based interventions. He's a long-term leader of the Los Angeles Children's Study, as well as now the director of the Southern California Environmental Health Sciences Center. And my background is in geography, but it's a bit confining for me. And so currently I have faculty appointments in spatial sciences, sociology, architecture. You can read the rest of the list. But generally what gets me going every day is that I wake up thinking about how spatial perspectives can help inform either what we currently do in the world, or perhaps more importantly, what we should be doing. And that work is increasingly taking me towards geodesign and architecture and disciplines like that. Next. Okay, so why population health and place? Well, I said I was a geographer by training. Most of my academic life has been built around geographic information science. And most people don't think of science, but rather think of geographic information systems. And there's a gazillion different platforms or toolboxes now that you can use to do this kind of work. And I'm interested in all of those, but I'm also interested in the body of knowledge, the theoretical and conceptual basis for why those tools have been programmed and why somebody might be motivated to use them. And in my mind, the science is the motivator, and the tools are just the things you use to help execute the ideas that you're interested in pursuing. It's kind of like the thing about the Nobel Prize in Literature. For all I know, the last Nobel laureate for literature used Microsoft Word in order to write the manuscript that won him world acclaim. But Microsoft's never won a Nobel Prize, and so the focus here is on ideas. Now, it's probably fair to say that I woke up one day and thought that a population health and place PhD was a good idea. And I was motivated by a couple of kind of signposts. So one signpost is, in the United States, if you compare life expectancy at birth by at the census tract level, the difference in life expectancy at birth between the census tract in Mississippi with the lowest life expectancy at birth and the census tract in the state of Washington with the highest life expectancy at birth, that varies by 40 years. So the worst performing census tract life expectancy at birth is 50 something, so I'd be dead now. And in a census tract in the state of Washington, it's 90 something. And in that case, I'd still have a third of my life left if I was just the average person born in either of those two places. So that's one signpost. The other signpost is that, you know, we have the same, as a country, we have the same life expectancy as Costa Rica, but we spend 6 times as much as Costa Rica does on healthcare on a per capita basis. And so by both metrics, whether our focus is on diversity, equity, and inclusion, or whether our focus is on efficacy, we're not seeming to do a very good job. And, you know, we do a splendid job in the doctor's office, assuming a person gets there with the right doctor at the right time. So there must be some other things that must play out and have some role here. And I thought some of them at least occurred at this intersection of population, health, and place. So next. Okay, so, and there are a lot of people at USC and around the country that are working on these things. These are 5 examples of big projects here at USC where several of our current students have found productive places to work and colleagues to work with. Rob, who's on the call here and will be speaking shortly, is the director of the Southern California Environmental Health Sciences Center. It's a long-running center. It's been running, I think, about 25 years. The Urban Air Pollution and Alzheimer's Center is a relatively new center. The Southern California Clinical and Translational Science Center is really big. It spans both USC and the Keck Medical Enterprise and Children's Hospital LA, among others. And the other 2 centers are long-running in various forms and very large, or relatively large, and very productive as well. Next. And, you know, the point for having that slide was really that it's all about team science. And so it's a multidisciplinary program. It's collaborative. We aim to be collaborative, and the kind of science we do is traditionally done in a collaborative framework as well. And so all of the pointers are heading in the right direction. Now, a few years ago, we have some very successful master's programs too. Some of those are taught online. One is the Geographic Information Science and Technology Master's Program. And this young lady here, Tran Bofam, she enrolled in our online master's program while she was a PhD student in epidemiology at the University of Pittsburgh. And I was her thesis supervisor. And the summer that she wrote and defended her thesis, she also did her qualifying exam and her proposal defense for her PhD in Pittsburgh. And so everything was carefully orchestrated so she could do that. She's a very smart young lady. And her master's thesis was about looking at the relationship between pesticide exposure and hepatocellular carcinoma using GIS in the Central Valley. And the contribution of her work was, the reason she did the work in California was that we have probably the best pesticide use records of any place in the United States. We typically know what pesticides were applied to what crops, where and when. But the ability to connect that to what's happening on the ground is a little bit tricky. And what she decided to do was to look at the phenology of the plants from a series of Landsat, from the Landsat archive, so that you could tell from the way the plants greened up and then died off which plants were in which fields, because you didn't typically know to the specific field where the pesticide was used. And then you got a much more fine-grained spatial temporal analysis of when and how often people came into contact with these exposures. Today, after a postdoc finishing her PhD at the T.H. Chan School of Public Health at Harvard University, she's an assistant professor of epidemiology in the Public Health Sciences Division at the Fred Hutchinson Cancer Research Institute and an affiliate assistant professor in the Department of Epidemiology at the School of Public Health in the University of Washington. So she's gone on to greater things, and with some of my colleagues, she's written a series of forward-looking papers that look at the connection now between population health and place, but looking at it through a kind of a geo-AI approach, so artificial intelligence. Next. So Spatial Sciences Institute, we just passed our 10th anniversary, so we're 10 years old. For a university, we've grown relatively rapidly. We have 16 interdisciplinary faculty, 32 faculty affiliates, 7 staff. This is the building we're located in pre-COVID times, and that we'll be located hopefully in post-COVID times, whenever that happens. It's in the center of the University Park campus. It's a collection of faculty and staff offices, classrooms and laboratories with space for various kinds of student researchers, including population health and Place Ph.D. students. We have a full suite of academic programs. I think at last count, more than 16. We have undergraduate programs, master's programs, and of course the population health and Place Ph.D. We have a growing research enterprise, and we now have a large computing infrastructure to support both our residential and our online students. We have in the master's space populations of both. Next. We try to be connected to industry, both as a source of the technology that we use for analysis. So this would be ESRI, where we're recognized as an ESRI development center. In terms of our relationship with other educators, we're a founding member of a worldwide network of online education programs in the GIS space. And we're a member of the US Geospatial Intelligence Foundation, which has accredited several of our programs, and for which now I think we have a new certification. Next. So Rob, I'll turn it over to you.
All right, thanks, John. So I'll comment on the Department of Preventive Medicine. We have, I think actually we have a good deal more than 88 faculty. I think we're over 100 at this point. It's if it were a school of public health, which at some point it will be, we'd be in the top 10 in terms of the size and the diversity of interests. We have epidemiologists, behavioral scientists, psychologists, people in law doing human rights and migration and health. We have just in our group in environmental health, we have 3 centers and a 4th one planned. We work sort of as a common theme. We all work on air pollution exposures, but there are many other things that we've branched out into. There's an interest in social factors and built environment. I mentioned those in particular because they cover place. You know, we're health people, so we do a lot with health across a variety of domains, neurologic disease from Alzheimer's to brain structure and IQ in adolescents to dementia and brain aging in adults. We're interested in obesity and metabolic disease, and just echoing John's comments about the range and longevity. There was a study a group here in Los Angeles published a few years ago looking at rates of obesity across school districts in Southern California, and there's a 10-fold variation from 4% of children in the Manhattan Beach school district, for those of you who are who know Los Angeles, to over 40% in school districts in more impoverished areas in South LA, and they very much correspond to the gradient of SES in these communities that John mentioned in terms of the in terms of mortality. So those are some of the interests that we have. We do a lot of work on in the department. There's a group that does statistical methods and bioinformatics. We've got some new interests in the climate crisis, so sort of overlapping interests with John, thinking about urban design and work with architecture and the health implications of these exposures. We do a lot with children, and in terms of exposures, in addition to air pollution that I mentioned, there are people who do work on PFAS, persistent organic pollutants like DDT and newer ones that accumulate in fat, endocrine disrupting chemicals, exposures that are ubiquitous in current life and that may have important long-term exposures. And those are the questions that we're trying to answer. We do respiratory disease. We have some of the studies that we've done have been highly influential for the development of policy. We have a new interest in environment and cancer, and it complements a very strong group in the department and across the medical school that does cancer etiology, cancer biology, and prevention, and some work on cures for cancer. So those are the opportunities that we have available. Yeah, we have a large teaching program and a lot of courses, and we have a lot of opportunities for research that span lots of different disciplines, and are opportunities for students. I think one of the ours is quite an interdisciplinary department, as I think I've communicated, but doesn't have the breadth of the population health and place program. That's much larger, and I think one of the challenges for us and one of the challenges for students is how to develop that integration and make the best use of the resources and the opportunities that are available. And I think that's we can help you with that, but that's up to you. Those are there are lots of resources here. A lot of the integration that we challenge you to do is something that hasn't been done before. So I think both the exciting thing and the challenge of the population health and place program is to identify a problem and then bring the resources to bear across the various programs to solve that problem. I'll make a sort of final, I'm looking at the slide here, I'll make a final pitch for our new chair, Howard Hu. He's very energetic and a really bright guy. He has a lot of diverse interests, and we're particularly pleased that he comes from the area of environmental health, and is particularly interested in the climate crisis. So we hope, John and I hope, that we'll see a lot of growth in this area.
Excellent. Thank you. Emily.
Hi, yes, thank you, John and Rob. So I am Emily Smith-Greenaway. I'm a faculty member in Sociology and also Spatial Sciences, and I teach the population courses in the PhD program. I teach the social demography course, which is a seminar where I get to expose you to, how to think about, how to take a population lens to understand structural disadvantage, the, health disadvantages in particular that John mentioned and also Rob spoke to, but also just to think more broadly about population and what are the tools that we can use and the perspectives that we can use to help you, creatively study whatever phenomenons of interest to you. I also teach demographic methods, where I get to teach you, really, the methods that you can use to analyze your population research that you're using in your dissertation. The sociology department is a very rich department, both in terms of substantive focus and also methodological approach. We have a number of qualitative sociologists, also quantitative sociologists such as myself, who study, not only health and inequality and demography, but who also, touch on issues of migration, labor, race and ethnicity, religion. And so certainly, you have access to those faculty who can really help you develop a broad sociological understanding of the inequalities that you're interested in, or patterns that you're interested in exploring in your work. We also have, speaking to the slide here, John notes that USC is a university that's very rich in interdisciplinary centers, specifically the Center for Economic and Social Research. And there's also, a lot of conversation with some stellar demographers who are over in the gerontology school. So we're really, what I love about USC, and I imagine it being a fantastic place to be a graduate student, because it's a wonderful research university, but UPC feels very small. Now Rob is up, in a different area of campus, and so we don't have the synergy that we, with preventive medicine that we do with everyone on UPC, but it's a small enough campus, when we're back in that physical space, that, there's plenty of room to interact with economists, at Caesar, sociologists, additional demographers who are kind of sprinkled across the university. But I'll just leave it at that. If you have any, I'm happy to speak more if you have questions at the end.
Thank you. Next, Aaron. So just picking up on something that Emily said, though, sometimes people think that I actually have an office and that I live on the health sciences campus, because in the last decade, since I founded the Spatial Sciences Institute, and then not long after that, generated the momentum so that we could create a new PhD program, particularly one like this one here. I've sort of made it my life journey now, so that 2 or 3 days a week I spend part of the day at University Park and part of the day at Health Sciences, and I perfected the art of broadening my reading by taking the shuttle for 30 minutes each way if I go backwards and forwards between the two campuses. So a lot has happened, and I think in the post-COVID world, the two campuses will be closer together, because some of this meeting each other by Zoom and so forth, I don't think is going to disappear completely. And so I see a more cohesive and more collaborative future for all successful scholars. Now, the next series of slides just give you a sense of how many faculty that we've been able to train and involve in this program. And you'll see that they come from a lot of different places. And again, to Emily's point, when you're thinking of demography and to some extent sociology, people no longer, they may be trained in one field, but they branch out, and there is a need for different people with different kinds of training in many different places. The first person on this list, Paul Adler, for example, is a faculty member in the Marshall School of Business. But he does work that's very relevant to what some of our students either do or could do in the future. And you can see that the people on this list here, the first one's from Marshall, the next one from gerontology, Ed's from Preventive Medicine, Lourdes is from the Keck School as well, Tracy, Tim Biblars is the chair of sociology, Ricky Blumenthal is an associate dean and a member of the Keck School, Carrie Breton the same. So you can just flick slowly through the next 3 slides, Darren. There'll be a total on the last one where you could stop for a minute. So we've been very successful, I think, at enlisting and in training a whole variety of people such that they're interested in this degree. One more, please. And if you took the time, as I did this afternoon, to count up that list there, I think there's a total of 44 faculty. And so, in this space, population health and place, given that we've now recruited 5 cohorts of students, this next year is going to be super exciting, because we might anticipate that maybe 1 or 2 or 3 might graduate. So we'll have our first graduates, and that'll be exciting. But what we've learned in these 5 years is that, you know, our competition so far, or at least the times when we've competed for graduate students and perhaps finished second or third maybe, the two places that probably we've seen our students compete well at, or our applicants compete well, is the T.H. Chan School of Public Health at Harvard, that little school in the Northeast, and the Department of Geography at the University of North Carolina, which has a long-standing interest and track record in sort of the geography of medicine and health and so forth. Next. So the degree currently works something like this. The first class has a pretty bold name, the Geography of Life and Death. Currently, I teach that class. This is the 5th time I've taught it. I think for the first time, perhaps I know what I'm doing now. Then there's a 581, Advanced Quantitative Methods for Population Health and Place. And then there's these 3 tracks. In Preventive Medicine, there are 3 courses. In Sociology, as Emily said, there are 2. And then on the spatial side, there are 3 more. Now, sometimes students come, you know, with very deep backgrounds in one of the 3 contributing disciplines. And so in those cases, they might substitute other courses in that domain for the ones listed here. But the other thing that's unique about our degree here is that there's a 601A-B sequence that's taught in the first 2 summers. That's really about learning about research as an enterprise. And so in the first summer in 601A, the students are asked to either write a review paper or an empirical paper on something they're interested in, some topic they want to explore that's presumably a candidate to be part of their PhD dissertation. And then we have a faculty jury system that gives them feedback once they're done. We're just doing that now for this past summer. And then 601B is where they take a crack at, with a faculty guide, mentor, to writing a first draft of a complete PhD dissertation proposal. And as well as doing those things the first 2 summers, you know, when we talk about the financial package for students in this program, offers, when we make offers, are made for 5 years. And the first 2 years include a top-up to cover the first 2 summers when students are enrolled in 601A and B. So you have a 12-month stipend for each of the first 2 years, and you may or may not have that the last 3 years, depending on how you get aligned with research projects, research opportunities, other fellowships, and things like that. Next. And then, of course, there's a suite of classes you have to take. It varies depending on whether you're coming directly from a bachelor's degree or from a master's degree. But there are many other courses, both in preventive medicine, sociology, and spatial sciences, and elsewhere on campus, where you might find value depending on your interests and what you settle on for a PhD dissertation topic. Next. Well, that's a long list. Recommended prep courses. I think on our website, it'll tell you those, but basically some knowledge of certainly 2 or 3 of these domains would be helpful. The admissions criteria, we're looking to select a small number of students that are super motivated, have super good track records, have really big ambitions. We're not just in the business of creating new professors, although that's certainly one way in which a person can choose a profession, and with the idea they change the world. But we try to support students that want to make a difference that's perhaps more immediate than what somebody like me does. So, you know, in a public health department or in the CDC or NIH or in private sector or public sector. The funding I talked about, currently USC, I think, makes a minimum offer of about $30,500. It includes health insurance and tuition remission. And then in the first 2 summers, we top that up with an additional third. So if it's 30,500, then basically we pay 10,000 and change in addition to that in the first 2 summers. Those numbers have been rising. This last year they stalled, so there was not a rise. Perhaps it has something to do with COVID-19, I don't know. And you know, I'd be remiss if I didn't say that it's a bit of a struggle for some people, because Los Angeles is an expensive place to live. And there are other funding opportunities. There are competitive fellowships as well. Our funding package, I should say, includes 2 years of fellowship and 3 years of either an RA or a teaching assistantship. Our current PhD students have been pretty successful at finding research assistantships. In fact, so far, I've never had enough graduate teaching assistants in any semester since we started this program. I'm always looking for additional people to fill the gaps. And they've been moderately successful at winning competitive fellowships where they get to devote additional time to just working on their research. Another major difference between our program and other programs, I see it as an advantage, but I've come to realize that students see it as something to be worried about, is that we have an admissions committee that basically is 2 people from the Keck School of Medicine, 2 people across the university from sort of the population science domain, and 2 people from Spatial Sciences. And then I sort of run that committee. For one, I have to figure out how I fund whatever the recommendations are. But so far, the committee with that composition has made more or less unanimous recommendations. We've generally had more students people would like to recruit than we have funds for. We have funded in the last 5 years anywhere from 3 to 6 students a year, but we don't align them with advisors. Anybody that appears on the admissions committee that says they're looking for students for themselves is politely told they can't do that, and if they refuse, then they get replaced on the committee. And so what we're looking for is the best students. And we try to give them 1 year to do the rounds and sort out who it is they want to work with. And this is unlike a lot of other PhD programs where perhaps you're coming in on somebody's research money, and so you're coming to work with a particular person who you may or may not know very well. And you know, what are you going to do after you get there if you don't like them? And so we've decided that a better approach is to give people the space to find an advisor. And in this case, in this program, we require 2 advisors from at least 2 of the 3 domains. So, you know, it could be a person from sociology and a person from preventive medicine, or it could be from spatial and preventive medicine, or it could be from spatial and sociology. I haven't tried to add up those combinations, but I can say that the very first person to pick 2 co-advisors chose 1 in sociology and 1 in emergency medicine, which is another department on the Keck School of Medicine. So while we run the program, we mean to be agnostic as to how students find their path, and we hope they find their path based on their interests and aspirations in life. And I already spoke to the career trajectories piece at the bottom when I spoke to, we're interested in helping to shape and promote tomorrow's leaders. And there are many places to establish leadership roles in addition to being a faculty member in a research university. Next. There's some of our PhD students. A random selection, I think. Some of them, I think, are in the audience. If I have seen their faces. Next. Okay, we get to the most important part, I think, which is some time for questions and answers. Dayron, how do you plan to do that?
I think we can just have folks unmute or raise their hands and unmute and ask their questions, or if they want to type it in the chat.
And could they also identify, well. Dayron, could they also identify who they're pointing the question towards?
Yes.
Yep.
So hi everyone, I'm Susan Kamay. I'm the Managing Director of the Spatial Sciences Institute. And actually, since we do have a few of our current students online, maybe we can have them just say hello and introduce themselves.
Yeah. You want to stop sharing the screen, Darren?
Yeah.
Thank you.
Hi, I'm Razia. Actually, I'm now a PhD student in chemical engineering. So I want to know how I actually can apply for this program, and is that I'm now I'm now a PhD student. So is there, I want to know, is the advantage or disadvantage in your mind? So, I want to know that if I already have my PhD or I'm in the middle of my PhD, is it an advantage for my application or not?
Wow, that's a pretty unique question. I really, I mean, I'll just confess, I don't know the answer. I mean, the kinds of things that in my mind seem to impress the admissions committee, and I think both Emily and Rob have been on the admissions committee, so they can speak after me, is it's why do you want to do this degree? And in your case, you've probably got to offer some explanation if you were going to depart one degree and start another one. What led you to that conclusion, and why would that be a good idea given your kind of career and life aspirations? I think everybody has a unique story, so there's never a formula that sort of describes the people that we make offers to, and also then why we make offers to them.
Okay,
Emily or Rob, anything to add?
Yeah, I'll just say, I think what comes to mind, on the selection committee is certainly fit in the program and, how well we think that you'll do in the program. I mean, as John said, we certainly want students to succeed. And just reiterating that I don't think it's either a strong or, a positive or a negative, but, we're very happy to review your application, and we'll, use the same kind of parameters to review it as all other applications.
Thank you so much. And is there the application online, on the webpage, so we can apply for it, or we should email someone, or how it works?
It's a standard application, right, Dayron?
Yeah, it should be right on our website. It should take you to the graduate programs. So it would be the same way that you apply for any graduate programs at USC.
Oh, okay, got it. Thank you.
No problem.
Okay, so back to Susan's suggestion. Shay, would you like to maybe introduce yourself and just say what you do and what you want to be when you're done?
I don't know what I want to be when I grow up yet. So I'm Shay. I'm a third year in the program. I am defending my dissertation proposal this semester. And so then I'll advance to candidacy. So that means I'm done with all of my prerequisites. So what I'm looking at is my co-chairs, building off what John was saying, mine are in sociology and in spatial science. So I come from a spatial science background, and that's where my interests are. And the sociology side is no joke. It pushes you in a very, if you're not familiar with that side of it, it pushes you deep into theory, and it's pretty awesome. And yeah, and the public health side is also awesome. I love the classes there. So I'm looking at how structural racism affects emergency room access, and essentially throughout the city, and how the structural, like a lot of the laws during the legal time of segregation from emancipation through about 1968 kind of really affected how hospitals were built, and where people are located and how they get there. And so that's me.
Okay, thank you. And by my count, there are 2 more PhD students here. SHEN, are you here?
Yes. Hi,
Yeah.
I'm Yu, and I'm a second-year PhD student here. And my research interest is now focused on the air pollution and its impact on children's autism. And now I'm working with Dr. McConnell here. Yeah. And yeah, I'm still doing some coursework here in my second year, and yeah, for my future, I'm thinking about being a professor, yeah, in the academia, and yeah, that's my yeah, plan for now. Yeah.
And Shen, what background do you come from?
Oh, okay. Yeah, my background is on GIS and computer science.
Yeah. Okay, thank you. And Kate, I think you're here too.
Yeah, hello, I'm Kate. I'm a fourth year in the PhD program. My interests are in environmental health and environmental justice. Before this, I did a master's degree in environmental health and global health. And yeah, a lot of the work that I'm working on currently, I'm looking at a region in East Los Angeles, in the Los Angeles area, that has been historically contaminated by industrial sources in the area, and just taking understanding the spatial distribution of that contamination, as well as how it's affected the population in the area. Yeah.
Okay, thank you. Mallory Prentice put a question in the chat, and it was she was asking whether in an application whether you just specify a general area you want to work, or you have to have a well-developed dissertation title. I think either one is fine. If you don't have a well-developed dissertation idea, then it's better to focus on sort of the general area in which you want to work. In my case, many decades ago, I went halfway around the world to do a PhD, and I just had in my mind that I wanted to do something about the environment. And you know, a year and a half later, I still wasn't much further ahead than I still want to do something about the environment. So, you know, sometimes it takes a little while for things to gel, but it's, you know, I think to Emily's point, I think one of the things that the admissions committee sometimes wonders about is what's the likely fit for a person. And so, you know, we do a lot of different things at USC, but we don't do everything. And so, you know, I think it's in your interest to first establish that you think this particular institution has the mix of things you are interested in. And then you want to try to situate, you know, how you would use those assets to build a credible dissertation topic for yourself. And there are, you know, it could be speculative, it could be well developed, it could be any of these things. There's another question in the chat from Aya. I noticed.
John, I think Ahmed has a question.
Okay.
He has his hand raised.
Okay. All right.
Yes. Hello. Thank you for having me in this conference. Actually, I had a chance with Mrs. Kami in user conference in San Diego. It was an online conference this year. So I have a question regarding to the background that you are prepared for this program. Do you have a specification for background? Because I have a master's degree in GIS, but in environmental crisis. But as I see now that you prefer in something related to medicine or epidemic or something like that. So this is, I mean, this is the first question. The second question, do you require that a certificate or background coming from university directly to you, or you accept equivalent report, like report coming from WES or something like that? Thank you.
Ahmed, I didn't quite understand the last bit. In order to, let me start with an answer, and then you can ask me another question if I haven't got it done for you. I think in order to apply for a PhD program, you have to have at least a bachelor's degree from some accredited university somewhere in the world. And, you know, universities have a way of judging each other's degrees. And so, you know, that the determination of whether you meet that qualification is made in an office unrelated to all of us on this session here. there's another one in the chat that's like this that talked about, well, do you need a bachelor's or a master's degree? You can go to a PhD these days from either of those two launching places. It's really a question of your aspirations, how comfortable you feel. You know, it's going to be a bigger jump from an undergraduate degree to a PhD degree and PhD seminars than it would be from, say, the completion of a master's degree. We, to the best of my knowledge, we don't have any specifications about what background you have in health, in public health or sociology or population science or geography or GIS. What you have to convince the admissions committee about is that you have a substantive interest in topics that lie at the intersection of population, health and place, and you have thought about how you could use USC as a platform to build the credentials you need to go off and change the world. That's in a nutshell the charge every year I give the admissions committee. And you know, so far, you know, as you saw with our 3 students, I think the results speak for themselves. How do you want to take the next question?
Thank you very much. Thank you.
Thank you. Baron, what's your plan now? Because there's plenty of questions in the chat.
I think there was another question regarding research in the chat from Joseph Toland.
Yeah.
He says, I have been active in research for the last few years. Will I be able to focus on dipping and expanding my current research immediately, or is there a timeline? Sorry, deepening.
It's a good question. It's hard to know how to answer that. Well, it would depend on what your current research is, because the immediate challenge is that you're going to submit an application, Joseph, and then you know, it needs to be impressive enough and inclusive enough that an admissions committee think that you are already working, or with some evolution, your work is going to focus on the intersection of population, health and place. Let's assume for a moment that you pass that threshold. Then, you know, I don't think there's ever a case where a university degree stops somebody from doing something earlier. But there are requirements that are set in order to earn a degree in terms of number of courses and things like that. So, you know, I can say, I think with some confidence, that most PhD students find themselves pretty busy with coursework for the best part of the first 4 semesters. And so, you know, you'll maybe be a bit surprised at how much time and effort that takes. And, you know, if you're like me, you know, I probably secretly had an idea of what I was going to work on when I went to Toronto to do my PhD. And, you know, after a year of becoming more broadly trained, I realized that my original idea wasn't not nearly so grand as I thought it was. And so with some luck, I settled on a completely different idea that turned out to be better for me, probably more influential in terms of who I am today and everything else. So, you know, it's a moving target, both for us as well as for candidates in our program.
I'll just add to that quickly. As John said, I mean, you are very busy with coursework the first few years, but most courses, you know, require that you write an empirical paper project at the end. And that certainly is a very obvious and clear, quick way to continue advancing your research towards the goal of publishing that research in peer-reviewed journals. So certainly, you know, coursework takes a lot of time, but, you know, at the end of each semester, we're expecting you to apply what you learned directly to advancing your own research. I had another point, but what was it? I don't remember, but I'll just say that, you know, coursework can help you advance your work, you know, as your, that's what I was going to say, you know, relative to other PhD programs, I would say that the coursework load is light for PHP. I think students can get through, relative to my experience and certainly most sociology programs. I'm not sure, you know, how it compares to health programs, but one thing that I really love about this program, and I think really facilitates student success, is that the coursework is relatively light and you really get to focus on expanding and developing your own research.
And the other thing, Joseph, is that quite a few of our students publish things along the way while they're still doing their coursework. In some cases, it's because of the paper they wrote in 601A in their first summer. In other cases, it's because they have lingering research that they do kind of sideways and part-time that they want to see through to completion. So there's many ways to cut this.
Thanks a lot. That was really helpful.
Jasmine had a question, Daron. Shall I try to answer that one?
Sure.
I think she's asking how much experience you need with research in order to be a competitive applicant. Is that a good summary, Jasmine?
Yeah, that's it.
Okay.
Thank you.
Well, since I know you, because I know what kinds of research you've done, I really don't think in yours or any particular case that's necessarily a problem. You know, life to be, I mean, all of us sometimes have to be our own salesman, and sometimes in order to get to do what we want, we have to oversell. And so you just got to do that cautiously, meaning, you know, there are projects for which I write proposals where, if I'm totally honest, maybe I don't actually know how to do the work yet. But if somebody funds me, I'm committed to figuring it out, right? So, but you know, so in your proposal, in your application, you want to be candid and honest, both with yourself and with us, about what kinds of experiences you have had. And, you know, it's sort of like how I think about jobs these days. A good job is one that trains you for your next job, right? And so what you want to do when you talk about your current and past academic experiences, to talk about how that prepares you for what you want to do next. And again, if you do that well, that experience and how you position yourself relative to our program will be unique to you. There's no kind of one answer that I think we're ever looking for.
Yeah, thank you.
Hi, John. I have 3 questions.
Oh.
I'm Chenxi. Okay. Yes. Okay. The first question is, what's the average GRE score of those accepted last year?
Wow. I don't know the answer. It's just
okay.
it's just one of a number of criteria we use. And I saw another question in the chat was, would we require a GRE in this application cycle? I think maybe Susan or Daron know the answer.
Ken's answered that in the chat. So okay. Because of the COVID situation and not being able to take the GRE in certain test locations, we can have you complete your application without the GRE score, but the word that we currently have is that we would hope that the students the applicants can take the test as soon as they are able and then submit the scores.
Okay, so we've answered the first question. What were the next two?
All right, thank you. The second question is, how many students is Spatial Department planning to enroll this year?
It's not entirely up to us, and it sometimes depends on the quality of the application pool. But so far in the first 5 cohorts, the minimum number we've recruited in a year is 3, and the largest class we recruited was 6. So I'm pretty confident that we will be between 3 and 6.
Awesome, thank you. I believe the last question is, what type of summer opportunities are there for PhD candidates?
Okay. Well, there are the first 2 summers you're taken care of, right? So
right.
Basically, you know, if the offer next year is, say, let's say, just to make the math simple, if the offer for USC students generally next year was 33,000, then our offer to people we make offers to would be for the first 2 years, 44,000. And so that would be paid over 12 months. And so you would have full funding, at least as we describe it, for 2 years. When that runs out and you revert to a 9-month either research or teaching assistantship, occasionally now in spatial sciences, I'm pretty confident that there will be teaching opportunities in summer if you have a need to earn extra money and you like that opportunity. And many of our students have been successful at finding research assistantships, not just with their supervisors, but with faculty spread across the university, because they have knowledge and skills that other people need for their research projects. So, you know, I know, you know, this last summer was a particularly challenging one because of COVID-19. And we have, I think, at that time we had 18 PhD students, now we have 21. And of the 18, there was only one that didn't have already lined up some kind of summer support. And so I was able to put together with the Dornsife College some funds so that all 18 of our PhD students this past summer had some level of support during the summer months. So, you know, this is a big kind of sprawling research university, and faculty are encouraged to get research funds and do large research projects. And so there are always, seemingly for good students, good opportunities. And then some of these competitive fellowships automatically come with 12 months of funding. And so that's another opportunity. And there are internal competitive fellowships as well as external ones that students can apply for with NIH, with the National Science Foundation, and with various other special competitions like Ford and Mellon and things like that.
Okay, thank you so much for the information. It's really helpful. Cool.
Make a pitch for our T32 training grant in environmental omics in the medical school that Jim Gouderman and I are the directors for, and I think there are 5 predoctoral slots available there for people who are interested in big data and environment in some way, and we define that quite broadly.
So I'm seeing some really great questions in the chat, and we're at time. So what we could do is a couple things for those who are able to stay on. We're happy to answer a few more questions for a few more minutes, but Ken is put into the chat that if you would like to email either Ken or Dayron, and we're making a note of the unanswered questions, and we'll get back to you individually, or feel free to follow up with any other questions that you may have after we conclude here.
And well, let's decide we'll take 3 more questions.